This is NBC10 News.
Right now on NBC10 Responds, what's been called one of the greatest public health crises in the country. More and more pharmacies are disappearing from our neighborhoods, leaving some families with fewer options for potentially life-saving medications. NBC10 Responds reporter Valeria Aponte-Feliciano gets to the source of this problem. Valeria.
Jackie, they're called pharmacy deserts. You might not have heard the term before. It's when a community's pharmacy closes, the next nearest one might not be as accessible.
This is my diabetes medicine.
Melinda Fields was 3 days away from her medication running out.
That's a matter of life and death.
The Northeast Philly Rite Aid Melinda was going to closed with the rest of the chain locations last September.
Stay on the phone for self-service options.
Her attempts to find another pharmacy near her home did not come easy. She relies on public transportation. Her closest option would require a long trip to pick up her meds.
Just don't feel like I should have to take all these buses to go get my prescription.
Other Pennsylvanians are facing the same issue. According to the PA Department of State, more than 400 pharmacies have gone out of business so far this year. This is fueling what's called pharmacy deserts. In a city, it means that a person lives more than a mile away from a pharmacy. In the suburbs, it's 5 miles, and it's 10 miles in rural communities. According to GoodRx, in our area, more than 250,000 people live in a pharmacy desert.
I think this is one of the greatest public health crises in the country.
Steve Anderson is the president and CEO of the National Association of Chain Drugstores. It represents pharmacies across the country. Anderson says the main cause of the closures are pharmacy benefit managers, or PBMs.
They're putting more pharmacies out of business.
PBMs are a third-party middleman that goes between drug manufacturers, insurers, and pharmacies. They determine which drugs are covered by an insurer, how much they cost, and ultimately how much pharmacies get paid.
The middlemen who add no value in terms of what they provide.
The Pharmaceutical Care Management Association, a trader organization representing PBMs, disagrees that PBMs are to blame for pharmacy deserts. Greg Lopes is the group's vice president of public affairs.
In rural areas, there are a lack of providers, hospitals, doctors, and that can lead to pharmacy closures. People are now getting their drugs online.
Lopes says PBMs negotiate to get lower prices for drugs.
It all starts with the price of the drug, and only Big Pharma can set those prices.
The drugstore industry wants the state of Pennsylvania to do more to protect pharmacies and regulate PBMs.
They're not enforcing the law as it should be done.
That law is the Pharmacy Benefit Reform Act. It was passed and signed into law more than 1 year ago. It gives power to the insurance department to regulate how PBMs operate in the state.
That process had been very opaque, and it's one that really costs consumers a lot of money out of pocket.
Michael Humphreys is the commissioner of the Pennsylvania Insurance Department. The law forces PBMs to be more transparent about how they do business, including payments to pharmacies. Humphreys adds it also gives pharmacies more of a voice.
The pharmacists can complain to us if they feel like, for instance, a PBM is giving an affiliate better terms.
But enforcement of the Pharmacy Benefit Reform Act won't start until next year.
And this one is for my...
As for Melinda, she's concerned more pharmacies will close and she will have to go further to find one.
They have to realize we are human beings and we need that medication for our life.
Now, the industry spokesperson says PBMs are already regulated and doesn't see the need for more. We're going to stay on top of the story and check back with the state once the 2026 enforcement begins. For NBC10 Responds, I'm Valeria Aponte-Feliciano.